Okay, so now we're going to go through some real life case studies Solo has been helping with. And all of them is real, genuine people we've been working with in the past month. If you have any thoughts of people you know that can enjoy the same benefits as I'm going to talk on now on the presentation, please do write them down. And at the end of this part, I will ask you to write them in the training form because we're going to go back to those people when we finish. So I'm going to go through one by one on five major topics on which Solo is working with. And the first one is agitation, which is such a challenge for people living with dementia and Alzheimer's and in general cognitive decline, and not only, but mostly in those area. And it's one of the most common challenges caregivers rate that they meet on a day-to-day basis. So people working with Solo, meeting Solo on a daily basis for at least 15 minutes a day have reported less agitation and less stress. You see the numbers, and the sleep cycle is getting better as long as you use Solo on a daily basis just before you go to sleep. And cortisol and dopamine, which are hormones we want to see less and more in the bloodstream, they are also affected by the use of personalized music, which Solo can deliver the best. So those are the general numbers that we see with Solo when it comes to agitation. And if you go to a specific case study, this is David and Sheila. She has high levels of anxiety and stress before medical exams, which she has to endure frequently. And he has high levels of agitation all day long, what we call sundowning. So both of them are going to use Solo at their room. You see the setting on the right side. She can do it before medical treatments. He can do it best on the morning and sunset. She and he also 30 minutes. This is like a double Solo dosage. We recommend that the minimum amount of time you use Solo is 15 minutes. 15 minutes of a session with Solo. This is what he needs to take you from point A to point B. So 30 minutes is like double the time. And it's very helpful and more if the symptoms are pretty severe. So you see 30 minutes before during medical exams, and for him, morning and sunset, and you want to see them more calm and receiving treatment more relaxed. And in agitation in general, we know that it's closely related to restlessness, sleeping issues, aggressiveness, and hyperactivity. And all of those symptoms are, we see them decrease when you meet Solo on a daily basis. The next one is loneliness, which now comes to, a lot of people talk about it since the COVID-19 situation, but we know loneliness is such a challenge for the aging community, and not only for people in the community, but also people in nursing homes and hospitals. The life changes. We don't have to explain on the why, but we do have to talk about how we can help those people. And 33% less loneliness is not something, that you see every day. And this is self-reported after 15 minutes of Solo use for a daily basis for over a month. So after 28 days, we start to see major changes, and we see them from day one, but they accumulate. So after a few days, we see them goes high and high, and we see less loneliness and more joy and happiness. 53% more joy and happiness. Those are great numbers. More oxytocin, this is the hormone of love, and more dopamine, as we said at the last slide. Those are all hormones we want to see go high and high, and they are closely related to a less loneliness feeling for the person. Those are case studies. Simon and Amy. She has a challenging time. They on a daily basis on the sunset. She feels very sad and anxious before the evening time. So we're going to give her Solo at her room or a joint space at 30 minutes before sunset, and that's the way she can feel more calm and positive at those times. And for him, he is often showing signs of low mood and emotional distance. And again, we want to start at his room because we want to give him and Solo the chance to connect free of other disturbances or sounds or people walking by. So just him and Solo at his room. And after they are well connected, after 10 to 15 Meetings, we can do that also outside or at joint spaces where other people are at. And this is also nice because when you look at people, when you are lonely or alone or feeling lonely, and you look at other people outside, you feel they are alienated or strangers. And when you listen to music that is the right music for you emotionally, and we're going to talk about it, those people can seem more relaxed and open-minded and even closer emotionally to you. So after you are well equipped and known, you and Solo are, friends, you can start using and meeting him outside or a joint space. So 30 minutes once a day or 15 minutes before joint activity. We want to see him participating in more often in activities and in more positive mood. So loneliness are what we call social distancing, lack of meaningful relationship. And you can see a lot of the time close relation to depression, sadness, and especially around the evening time. So this is loneliness. The next one is reduce pain. So physical pain is a challenge, and the opioid epidemic showed us that people are just getting used to take the next painkiller, which surely have side effects and in some cases are addictive. But music, emotional based music, and solo, who does it the best, can bring 32% less reported pain with solo and 26% less inconvenience while in medical treatment. This is amazing how emotion based contact can make you feel better on the physical side of it. So this is the general numbers, and in case studies, real case studies, you see Al and Rosa, both of them are over 90 years old. She has chronic pain, arthritis, severe backaches, and he lives with diabetes, and is often endures medical treatments. And for them also at her room first to communicate, to connect with Solo, and then outside or at joint spaces. For her, 15 minutes per day and 30 minutes when needed, if that's an option, to give her a solo whenever she feels pain or alone or both of them. That's the best. And for him, 15 minutes per day or before treatments, and we want to see the pain level decrease. So those are the symptoms or diseases or challenges that we are working with, that Solo is working with worldwide. But of course, you can use him for any physical pain and not just for the list that you see here. The next one is motivation, which is a great challenge also because when the motivation decrease, so many other challenges rise up. So 25 more percent of communication and 22 more percent of energy levels when you use solo. And those two are closely related to motivation. And you can see 23% more positive approach to therapy, 26% more memory recollection, and 14% more verbal. All of those are really, really, really important for motivation because when a person doesn't remember where he is at, the chances that it's going to be motivated for anything. And I'm not talking about activity or going running. I'm talking about getting out of bed and going to breakfast or taking a walk outside. So when your memory is more alive and when you listen to the right music, it will happen. And when you have a more positive approach to therapy and to everything, it probably means that the motivation will go high also. Another thing, and you can see here on the case studies, John and Grace, you see he is not communicative and she refuses to take part in any activity, and apathy is maybe the most common challenge that caregivers rate as the most common challenge for them when they work with people living with dementia, and not only but mostly with Alzheimer's and dementia. So for him, I'm going to give solo at his room only because we want them, to feel safe. He's apathic. He's not communicating. So I'm going to start at his room, and maybe after a while, I will consider to go out 15 minutes, 3 times a day, morning, noon, and evening. And we want to see him showing signs of communication and positive mood. And for her, again, at her room until she feels safe, and then outside or a joint spaces 15 minutes before inviting her to an activity. Because when you give her solo before that, she will probably be more relaxed or positive about doing anything. So that's the motivation part. And you see that lack of motivation for residents or for patients, it comes with refuses to leave their room or their bed, negative feeling towards any kind of change, or they get bored fast from any activity or meeting. So those are the four major ones that we are working with. And the next one is going to be for staff, but that's going to get another video and you're going to get to it next, how you can sort and how Solo can help you. That's the next step. So for now, please do write down if you had any thoughts about how to use Solo with the people you work with. Write 5 people down at least, and you're going to get to write them soon on the form you're working with, on the training form, and we're going to get back to them soon. So let's move to the next step. The next video is about the staff. So I will see you soon then, and we'll take it off from there.